Hello, everyone, and welcome to Sostento Live. So excited to have you all here. I just want to welcome you to today's event. Before we get started, I'd love to know who's here. You can shout out where you're listening in from, which clinic you're with. If you're a frontline health worker, we want to know which clinic that you're with. And if you're having any trouble commenting, you'll have to sign into a Google account. So if you want to put any comments in, you'll have to sign into the Google account. If not, no worries, just enjoy the show. I saw that we have a number of folks that already said hello. Let's see, we have Sherry from one of our network clinics in Mobile, Alabama. Hi, Sherry, hope all's going well at the charitable pharmacy down there in Alabama. We had Heather from Good Sam. That's the first clinic Sostento ever started working with. What's up, Good Sam? Good to see you. Erin, in Cincinnati, Ohio, another charitable pharmacy. Welcome. We also have some Sostento staff. Emily, Jennifer, Christine, all members of the Sostento staff are here. Glad to have you. Linda in Missouri, one of the oldest free and charitable clinics in the country, Social Welfare Board. Hi, Linda. Hope you are doing well. We got Kesha, Community Health, Community Holistic Advanced Practice Nurses. I believe they're in the Atlanta area. Hi, Mary. How you doing? Good News Clinic. One of my favorite names of a clinic, the Good News Clinic, and down there in Georgia. You're very, very welcome. Juanita, hello. Juanita, how are you doing? Oh, sorry, Good News Clinic's in Gainesville. Yep, Gainesville, Georgia. I thought it was there in Georgia. We got one more to say hello to. Juanita, nice photo, Juanita, looking good. From Pathways Free Specialty Clinic in Petersburg, Virginia. It's so good to have you. So again, if you're here, say hello in the chat. I know some people will be watching on recording. There's a lot of events going on. I know there's the National Association of Free and Charitable Clinic Conference. There's another HRSA conference going on. So some people will be watching on the recording later. So welcome if you're watching on the recording. So today's Sostento Live is really a celebration. It is a moment to look back at one of our biggest achievements that we have been able to accomplish this year with our free and charitable clinics through our HRSA program, our COVID workforce program. And we've been working with the free and charitable clinics since 2020, since the beginning of the pandemic. We have been doing webinars since January of 2021, and those webinars were always private with just our clinics. What we decided to do with Sostento Live is to make some of these insights and things that we are learning public through this kind of YouTube and LinkedIn stream that we're doing here. So that's, we really just want to share more with other free and charitable clinics. I know we have some HRSA officials here today, so I want to say welcome to you all as well. We're looking forward to sharing some of our insights specifically about our achievements on data collection in this project. Where I would start is that why we thought it was so important through this project to work on data and to highlight data is that without good information and data from the front line, we can't understand what's going on. We can't allocate our resources, the best that we can. We can't see trends and insights. However, we also know that frontline health workers, especially those serving our most vulnerable, don't have the time in the day to collect data. It's a very difficult additional ask to collect data that might not be routine data that is collected. And that matters that the data isn't being collected, because that means you all can be a blank spot on the map. The federal government, donors, even Sostento can't know exactly what's going on in your communities and at your clinics without that data. So that was really the problem statement that we began with, which is if we're not collecting data from these clinics about their COVID outreach efforts, around what they're doing with the vaccine, how can we know what the impact is we're having, what adjustments we need to make without that data? So, we had been collecting data, but very lightly starting in 2021 about the vaccine. There was a monthly kind of how many vaccines self-reported by our clinics in our network. How many vaccines do you think you're doing? And so we did have that at least monthly kind of milestone of how many vaccines were being submitted. But then in 2022, thanks to HRSA funding, we were really able to up our data collection game. And so that is what we're going to be exploring today on Sostento Live, is how did we achieve data collection across 100 locations across the country, rural, urban, suburban, all different types of populations, with a single data collection tool and approach. We're going to talk about how we got it done, and we're going to look at the results of collecting that data since March of this year. And quickly, just some highlights of what we've been able to achieve in this program, in this data collection program. We've put out over $4 million to free and charitable clinics across the country, 100 different locations for their workforce. 100% of that funding went to the workforce. There are 86 clinics, 100 locations. Over 200 health workers are using this data collection tool to submit information about their COVID vaccine efforts. And we're going to look at that a little bit later in today's show. And I can proudly say to date, since early 2021, our network has achieved over 200,000 vaccinations of some of the hardest to reach and most vulnerable individuals in our communities, those who might have extreme hesitancy, who have mistrust, who have a hard time even accessing vaccine. We've done 200,000 of those since the beginning of the pandemic. And the vaccine was approved in early 2021. And today we'll be looking into the data that we've really been collecting in depth since March of this year. So I'm looking forward to that. And before we get into some of the details, some things I want you to listen to during today's live event is how do we make this data usable? How do we take, data is only as good as the action you can take with that data. So really consider, how do we make this data actionable? How do we simplify? How do we simplify the data collection process and the tool to allow clinics who are super busy, who don't have an extra minute in the day to successfully collect that data, both by the health workers and their patients? And how do we make sure that we kept compliance to HRSA's data collection requirements was a really, really important piece of the puzzle. So those are some things we're going to cover today. But before we jump into our first guests, what I want to do is share with all of the clinics and all of our guests today a video that showcases the Sostento team talking about the impact of this work we've been able to do with HRSA. It's kind of our thank you love letter to HRSA for all the work. And so we've created this, we've shared it with HRSA. Now we want to share with all the clinics a little thank you video to kind of warm us up to today's event because we're so thankful to HRSA funding that made this possible. So let's cue over and let's take a look at that video. Welcome. My name is Joe Agoada, and I'm the CEO here at Sostento. We're a 501c3 nonprofit with a mission to help frontline healthcare workers save lives. We've been working tirelessly since the beginning of the pandemic to increase access to life-saving COVID care for families living below the poverty line. It's really been exhausting work, but totally meaningful. This year, our work has been taken to a whole new level thanks to the support of HRSA. Funding provided by HRSA has allowed us to create an amazing impact and increase access to the COVID vaccine in communities across America. What I want to do is let you hear a little bit more about that impact and what we've achieved through the project through the Sostento team themselves. So sit back and take a listen.
Thanks to HRSA, Sostento has been able to provide critical support to 85 free and charitable clinics on the front lines of the pandemic response.
We distributed sub-awards to clinics totaling $4 million, with 100% of those funds going towards workers doing vaccine outreach and administration.
This funding is providing resourcing for over 200 community health workers who are out in their communities battling misinformation and providing education on the vaccine.
From hosting outreach events to running education campaigns online, our network of clinics are building new, lasting relationships in their communities.
Our clinics serve rural, urban, and suburban areas covering a wide range of racial and ethnic minority communities in 16 states and 600 different zip codes.
All of our clinics are united with Sostento to serve families living below the poverty line, and together we represent the amazing diversity of our country.
The free and charitable clinics in our program are all nonprofit. They're run through donations and through volunteers, and this pandemic has stretched them like never before.
HRSA nos dio la oportunidad para crecer la capacidad administrativa de las clínicas y ponerles en posición para crecer y servir muchísimas más miembros de sus comunidades.
Our team has been innovating new ways to increase vaccine access by designing approaches that dismantle barriers faced by marginalized populations.
For example, our free COVID helplines, where clinic volunteers working from home answer calls to assist individuals in getting vaccine education and scheduling appointments. To date, Sostento has answered over 120,000 calls for help.
So we are using rideshare technology to eliminate transportation barriers and make it easier for those who don't have a car or access to reliable public transit to reach their clinics and make it to their appointments. We're very proud to say that to date we've delivered over 5,500 free rides with our clinic partners.
And rides aren't just for patients. Clinic staff and volunteers also use these free rides to do outreach and home-based vaccinations.
We built our own data to allow health workers to collect information on who they are vaccinating and why those individuals decided to get vaccinated.
We provide data collection training and technical support to our clinic network. And to date, they have submitted over 10,000 reports on their vaccination and outreach efforts.
The data collected by our clinics feed into Sostento's real-time dashboard, which gives us the ability to see what's happening across our network and pull out insights and national trends that help us focus our efforts.
Our data dashboard, combined with interviews from our frontline healthcare workers, allow us to tell powerful impact stories about the free and charitable clinics.
The past 2+ years have been unprecedented in the history of public health here in the United States and the world. I am so grateful to have worked side by side with my Sostento teammates and utilized this amazing opportunity to work with HRSA to help so many people. On behalf of Sostento, the clinics, the frontline health workers, and of course, most of all, the individuals who have gained access to life-saving care like the COVID-19 vaccine, I want to say thank you, HRSA. Thank you from the bottom of my heart for giving us this opportunity to show what we can do when we join together and take on a threat like COVID. Yes, I wanted to share that video with you all that we shared with HRSA. You've got to meet some more of the staff. You're going to hear the Sostento staff. You're going to hear from a few of them later in the event today. But I also, first, let me shout out, there's some more folks who are here. Hi, Michelle. Michelle is joining us from the Virginia Association of Free and Charitable Clinics in Virginia, and their neighbor, Mary Moore from the Tennessee Charitable Clinic Network. Welcome, Mary. Jody from the Hope Clinic in Austin. Welcome, Jody. Hui from the Boat People SOS Clinic. I know they're in the Atlanta area. From Atlanta to Chicago, Community Health in Chicago. Hello. Fatima, who I believe is also in the Chicago area. Let's see, Dennis, one of our leaders in Wisconsin from the Wisconsin Association of Free and Charitable Clinics. Hello, Dennis. Holly, Interfaith Dental in Nashville, Tennessee, to Memphis. Sharon, Church Health in Memphis. Rachel, Health Wagon in rural Appalachia, Virginia area. So we got the Open Arms Clinic and more. So welcome, everyone. I see everyone kind of cluing in. Maybe we'll see some more shout outs a little bit later. So yes, welcome everybody. So now the next section here is really exciting. What I'm going to want to do is kind of give you the feeling of what we went through to create the data collection tool, to get all of our clinics to uptake that data collection tool, and to make sure that through the last 8 months, we've been submitting data on a routine basis. This was something we had to do in a really rapid fashion. So we received notification of our award in November of last year. We got right to work. By January, we were building our data collection tool, and by March, we had all of our clinics beginning to collect data. So I want to kind of give you the feeling of the rapid fire work that went into making that successful. And so we are going to have 3 guests kind of come on 10 minutes each and talk it through. We're going to have Sostento's Chief Technology Officer, Sostento's Chief of Staff, and our key data and monitoring and evaluation partner, the Behavioral Science Research Institute, the Executive Director, come on. And we're going to go through each of those 3 segments kind of in a rapid fire manner, because that's how we got it done. So, we're going to get to hear from the folks that kind of led the process and were able to make this kind of data collection big success with all of the clinics. So without further ado, our first guest is going to be Daniel Acquah. He is the Chief Technology Officer here at Sostento. He has over 20 years of software engineering expertise in the field. He's worked with the federal government for a number of years. He's worked with major banks like Barclays and MasterCard, and he was the lead on creating this data collection tool. So let's go ahead and bring on our first guest, Daniel. Hello, Daniel. Welcome.
Hi, Joe. Thanks for the intro. How you doing?
I'm doing well, Daniel. So again, you're someone who has been working really hard for all these clinics behind the scenes. They haven't got to see you yet. But again,
Okay.
you're our CTO here at Sostento. You make sure
Okay.
all of our data is coming in. But first, can you tell me a little bit about yourself, your role here at Sostento, and then any relevant background in your technology you want to share?
Thanks, Joe. As you said, I spent about 20 plus years in the software development industry, mainly based in New York City, working for the banks, all those investment banks in the finance sector. But then prior to joining Sostento about 3 years ago, I had a chance to consult, do something similar for the US government, Department of Homeland Security. So what I bring to Sostento is years of software development. So what I'm doing right now in Sostento is building technology solutions to help our frontline workers save lives. That's pretty much what I do, software.
Well, thanks, Daniel. And I remember when we first met, it was actually you were looking for a volunteering opportunity. When
Right.
you first approached us, I remember you said, Joe, I've been doing all this, professional work for the government, for the banks, but you said you were looking for more purpose, more meaning
Yes.
in your work.
Yes.
And so how does that now feel being in Sostento and getting to do this kind of work? How does that kind of make you feel putting those skills to work?
It feels great. It feels great that I can see when you look at the dashboard, which you're going to show later, it shows us how we are saving lives. All this number of COVID vaccines, boosters that we have given based on technology solutions that we came up with. It's an amazing feeling. And then I can see how the expertise that we all bring as a team is benefiting lives in general. I like that.
Mm-hmm. Awesome. Well, thanks for that little bit of background, Daniel. But let's now go into the actual process that I came to you. I remember, I think it was end of last year. I said, okay, Daniel,
Yes.
Here's the challenge. We have to build one data collection tool that will allow health workers, many of whom have never collected data before,
Right.
to collect data. Not only that, but we need to make sure that we're doing it securely, that it can be shareable, that it could be collected out in the community. It could be collected in the clinic. A health worker could submit it from home. It could be a rural, an urban, a suburban clinic. They could be doing all types of different, types of, working environments. And I said, okay, that is your challenge. We knew again that the data was not going to have PHI. It was de-identified. HRSA helped us set all of that up. But then I came to you and said, how are we going to make sure this is both shareable and secure for our clinics across the country? So can you share a bit about what Sostento did in the beginning to make sure data was easily shareable, but also extremely secure?
Well, let's talk about data security. So when a clinic worker submits a form, right, they put in the data, the vaccine, the booster in a form, and they hit submit. That data gets sent in transit over the internet. So we have to protect that data to make sure that anyone that somehow, some way intercepts that data will not be able to make meaning of it. So we had to use cryptography and encryption protocols to secure data while in transit. Now that data eventually ends up in a database to sit somewhere. So now we're talking about data that is secured at rest. So what we do is we use very highly secured, password protected database that is hosted in the cloud in a very secure private network. So that is how we protected data in transit and at rest. One of the things that we did also for data security is to ensure that each clinic worker can only submit vaccine boosters outreach only for the clinics that they work for. So we generated unique identifiers for each clinic, unique Google forms that made sure that only approved workers can submit data. That's an extra level of security that we did. Yeah.
So you mentioned something interesting there. So you talked about data being at rest, right?
Right.
Maybe you can explain that more. So again, how I understood that is what you're saying is that you made sure that no matter which health worker, we knew it was one of our approved health workers that's submitting the data.
Yes.
They had a unique link. They had a unique identifier. We knew it was coming from them. So it comes from all these multiple locations, 100 different locations across the country.
Yes.
And it comes into a database that you've built. So all that data comes in, and then you said it sits at rest. Maybe tell me a little bit what it means when data is at rest, and what does that, for a layman person, what does that mean?
Well, think about it. If you send data over the internet, whether you're sending an email, whether you are filling out a form on the internet, whatever you're doing, that data is in motion. It gets sent over the internet, but eventually it sits. It resides somewhere in a form of storage. So that is why we use cool technologies like AWS, which allows us to protect and secure data that is at rest, which is data that various tools can pull and make sense of, makes insight on. So it is not moving, it is just sitting. That is what we talk about data at rest. Not in transit, but at rest.
So we can think of that our health workers exercise the data, and when it gets to Sostento secure, Amazon Web Services, AWS secure, then it rests there, it's secure, and then it can be used for analysis and other use cases.
Exactly. You got it right. Joe.
Got it. Okay, cool. So you shared a little bit about here kind of our initial thinking of how we were going to make it secure and shareable. But once we had that baseline security, the next thing we had to make sure was that the data could easily be collected by the health workers in a very simplified, quick manner. Because, you and I always talk about how busy the health workers are. It has to be simple. It has to be easy. We don't want to overburden them with the data collection. So we had to build a tool that could work for their environment. So maybe you can walk us through now that you've given us the baseline on security and shareability. How did we kind of build and design that data collection tool for this use?
Okay, one of the cool things that HRSA did was to give us options of how we collect data. One of them was SurveyMonkey. What SurveyMonkey does is that you put in all the vaccines, the boosters, the outreach, all the data, but it gets sent directly to HRSA. They also give us an option whereby we could submit the data every week on Mondays. So we chose to do that. We chose to build the data, collect it, and send it to HRSA every week. The benefit of that is, number one, we are able to collect the data before we send it to HRSA. That's an amazing thing. So we have a whole lot of data that we can build tools, dashboards, AI solutions to gain insights in. So we chose that approach. And to make it easier, we use Google Forms, which allows each clinic worker to be able to put in the data as defined by HRSA, and we're able to intercept that data before sending out to HRSA. One of the things that we did too, we use QR codes, which makes it easier for patients, let's not call them patients, we call them community members, to complete the form much quicker. We also had printable versions of the form. So when a clinic worker goes to a remote area where there's no Wi-Fi, you're able to complete the printable version, bring it back to the office, and later process it. And one of the other cool things that we did to make it easier was had the forms in Spanish. And we have the ability to do more languages. So it served very well for the Spanish-speaking population. So these are things that we did to intercept the data, get a record of it, to build solutions, insights into it, and to make it easier for clinic workers to fill out these forms.
Yeah, so I think that we created multiple kind of versions of the single form. It could be collected in different ways. One of my, I think, favorite parts of the tool that you built was something that made it easy for a clinic worker to have a community member fill out the survey, because when we submit the data, we need to know which health worker it comes from, and each health worker has a unique identifier number that needs to be filled. So if we just gave out a regular form to for a community member and they don't know the clinic code or the health worker code, they can't fill out the form. So maybe it's also not a short code. It's a pretty long code that they have to remember. So we created something really unique that allowed the health workers to not have to enter that data themselves. And if a community member was filling it out, it actually did it for them. So maybe you can talk just quickly about that.
Correct. One of the requirements from HRSA was to generate unique identifiers for clinics and the health workers when sending boosters, vaccines, outreach, whatever it is. So each set of questions, we didn't want the community members to fill out the same information over and over again. So the cool thing that we did was to pre-fill forms with the data that is needed from the clinic and the community worker filling out the form, and to make it easier for members to complete it. So all that happened behind the scene using a whole lot of software technology solutions, and that was pretty cool. It made it easier for forms to be filled out, for data to be sent, and that was what made it very, very cool approach for us, as compared to the SurveyMonkey approach, which was sent directly to the government, and every question has to be answered multiple times.
Yeah, I remember when you and our tech team came and said, hey, Joe, actually how we're going to approach this problem is that we're actually have every health workers get their own unique link for their form. And I thought I was like, wow. And it was very easy for you to generate new versions of the form. So each health worker actually had their own unique link to their own unique form. And it was the same questions, but if they gave that link out to a community member, and that became important because a lot of the information was better filled out privately, I remember. So by saying, here's my link, they gave it out to the community member. Because it was that unique link that you all had created the software development, it already had the clinic worker to ID in the clinic field, so they could just answer the questions. And I thought that was one of the things I think that made our data collection really successful, was that simple but meaningful way to preload important information and not ask the health worker or the community member.
Correct. That was pretty cool. Correct.
Yeah. Cool. Absolutely. All right. So we've kind of talked about the tool itself, the kind of key principles around shareability and security, but now we've just talked about the data's at rest. It's sitting in the database, right?
Correct.
And
Correct.
now we got to put that data to work, because it's just going to sit there. It's not going to give us any value unless we make insights and take action based on that data.
Correct.
So maybe you can share a bit about how you, once that data was aggregated, we had all the clinic data together, how did we then take that data and make it usable by Sostento and some of our partners?
Well, there are three things we had to do with the data. We could do with the data. Number one was to build a beautiful, fancy dashboard, which allows us to give us insights into the data. Example, what are the zip codes where there is higher or lower vaccination rates? What are the clinics that are not submitting data because is there an issue? So the dashboard gave us a lot of insights into the data we are collecting. One of the things we also did with the data is, remember, the HRSA requirement was to send the data every week to HRSA. So it allows us to build software solutions that will be able to go and pick up the data that is at rest, generate the HRSA sheets, and send them out. And the third most important thing is, long-term, after we've collected so much data, we can use predictive analysis, AI solutions to gain more insights into the data and find out how can we help frontline workers save more lives. So having that data and keeping it and building technology solutions around it was very, very, very important and critical to the success of the whole team.
Yeah, I remember it even got down to the point, because I said, like you mentioned, I have to submit every week. I say how many, all of our data from the past week of all of our clinics, I have to submit that. And actually, I just go into a folder, it preloads. So our team doesn't even need to do anything. It pulls out all that data from the last week. I have my spreadsheets, I download them, I just send them into the required submission to HRSA. So that makes my life easier. So that's one of the things I think we want to continue to do with technology here at Sostento, is to make our healthcare workers' lives easier, to make our lives easier, to make HRSA's lives easier, whatever we can do. All right, Daniel, well, I think you've given us a great rundown. Is there anything you want to say before you go to the clinics? You don't get a chance to talk to them directly, but we've got a bunch of them listening in. Is there anything you want to say to our free and charitable clinic partners before we let you go?
Well, a huge kudos to the clinics, because remember, all these fancy bells and whistles, all these technology solutions that we build are pretty much useless without the data. The data is what we need to feed into these technology solutions to make it meaningful. All the dashboards, all the AI solutions, they all need the data. So everything starts with the clinic workers. It's a huge job that they have done. They have been very patient, and I see the data coming through every day, and it's big kudos to them. It all starts with them. So I want to thank them and that they are part of the bigger picture, and everything that they do is very, very appreciated.
Awesome. Well, Daniel, thank you for being on here. Now all the clinics can know who's keeping very safe, watching over that data, making use of it. And I think in a future Sostento Live, we'll have to have you come back and talk more about that AI, machine learning, some of the innovative things we might want to do in the future. So we'll definitely have you on that. All right. So thanks, Daniel.
Thanks, Joe.
Thanks for joining us.
Joe.
Yeah, we got Daniel. Got a shout out there from Shelby. I know Shelby's in Wisconsin. Daniel, thank you. We definitely appreciate it. All right, so we're going to keep it moving. Now, Daniel has really talked to you about how we created the data collection tool, how we kept it, secure and shareable, and the ways in which we're using that data. But Daniel, in his thank you, mentioned that it's only as good as the health worker's ability to use the tool, to uptake that tool, and to submit that data. So what we're going to do in just a second here is we're going to bring on Sostento's Chief of Staff, Betsy Kalven. Betsy has been with Sostento since day one. By profession, she is a designer, and she's worked with big name companies like Continuum and BMW. And I've had the privilege of working with Betsy for many, many years. She is such a force at Sostento, and I think the clinics have not got to meet her yet. And she helped us design our process for actually bringing clinics aboard and using the data collection tool in a very rapid manner. So let's bring on Betsy so we can talk to her about how we did the training and uptake. Hi, Betsy.
Hi, Joe.
It's good to see you. Thank you for joining us.
Of course.
So to start, just tell us a little bit about your role at Sostento, your background, a little bit about you so the clinics can get to know you a little better.
Yeah, well, thanks for the intro. I have been with Sostento even maybe before day one, because I think my story is a little similar to Daniel, and I was working for corporate companies. I think I was working for BMW at the time, and I was like, I want to do something that matters. I want to work with good people. So I started working nights and weekends with Sostento, and then came on into a full-time role as design. And actually, I think we do this for all the people that work here. I have another skill set, which I have a background in clinical psychology. I sort of grew my role more into the chief of staff, moving away somewhat of the design and strategy, incorporating that. And now I'm a little bit more in strategy and team development. But I have 3 years under my belt here, and I'm sure I'll be doing many different things in the next 3 years.
Yes, Betsy has been here since the beginning, see us evolve, and now she's leading our next evolution about what we're going to become as we continue to grow and do many amazing things. And so let's jump into it, Betsy. So the kind of task I brought to you. So I said to Daniel, I need you to build the tool, but I told you, I said, hey, we need to figure out how we train 100 clinics and maybe up to 200 community health workers on a brand new data collection tool that they've never used before, and we need to do it in about 6 weeks. And so, but before we go into exactly how we achieved that, I think we should go back to 2020 at the beginning of the pandemic, because we had some learnings about how can we rapidly onboard frontline health workers to a needed tool in a very short amount of time. And that was with our Helpline SOS tool, our COVID helpline tool. So our first one, I said, hey, Betsy, can you figure out a way that we can onboard a bunch of clinics to the helpline virtually in a short amount of time because they desperately need it? So maybe let's start going back to 2020 with the helpline. And how do you approach a design challenge like that? And how did we end up kind of figuring out a way to do it?
Yeah, it was no small challenge, and it was a really early stage of the pandemic where we're getting so much information. So I feel like what we did was we sort of stopped. We had a huge amount of clinics, completely different, and we're like, let's make sure we're doing our learning, which is always what we try and approach every project with. So I and other teammates went to some clinics we were working with to really understand their realities. Again, there's a range. There are people with full staffs, and there's people that are volunteers in a church basement. And so we needed to find a solution that would work for all different kinds of clinics with different kinds of tech sort of capabilities. I then also went to our team to understand, like Daniel, what kind of data do we need? What kind of information do we need? And then it was a bit of marrying those two need sets together to find like the minimum viable way forward. And I know I'll go into more depth, but I would say some learnings we had. We threw out a bunch of ideas and had many clinics like Good Sam and other clinics we work with closely, help us see how to make those ideas better. We really thought, we wanted clinics to be able to do it on their own as much as possible, but we realized we needed that in-person one-to-one conversation that, sending them a packet of information would just, I think we knew that more questions would blossom. It would leave clinics not feeling empowered. It would put probably more onus on our team down the line. So we needed to find a way to come together with the clinics, but we couldn't meet one-on-one with everyone. So we came up with this sort of cohort model of let's bring groups together, let's have calls. But again, trying to find that right balance of robust information, not overwhelming people, setting them up for success, but not having 20 meetings at once.
Yeah, I remember now you're taking me back where we kind of knew just, I think we even thought, can we send them a video of like how the training works? And we realized, no, we need to really train people in person. And I remember we kind of broke that down into like, what are the segments of in-person stuff, which ones need to be group meetings. So I remember some of them we said, hey, we could have a bunch of clinics do this training, but there were cases, for example, when they were figuring out how to integrate the tool into their specific clinic, they needed that one-to-one attention of like in your environment, how would it work? And
I think we also did the groups, the one-to-one, and then we had office hours. So we'd hold a time if people wanted to just jump on and had a question, that we'd have that space too. So we created kind of 3 spaces with Helpline SOS, I think, when they're onboarding.
Yeah. And so that was incredibly successful. We had, I think, over 30 clinics that uptook the tool. I think we're very proud, over 120,000 calls answered. And so I think various times from that Helpline SOS experience on, we went through kind of iterations of how do we onboard a lot of really busy frontline workers onto a new tool. So by the time we got out to the data collection tool, I think you kind of had, a really good sense of what we could do and how we could do it as, productively as possible. So maybe talk me through this kind of robust, well thought out onboarding process we did for the data collection tool. Can you walk me through how we ended up doing it for the HRSA project?
Absolutely. And I will say I may have been the beginning sort of research design. And then, like you said, so many people have picked it up and made it better. And clinics and health workers have told us. So it's been this thing that's been molded over time. And this particular data collection was really led by Jason, an amazing designer on our team. Well, he does so many things, including design. Wonderful person named Rose. So I hope some of you have met her. She was a program coordinator at Christine. I mean, I can't even tell you how many people have touched this work. So I'm speaking on their behalf. But at this point, having been through many iterations of onboarding, I think we dialed it in. There were a number of learnings we found. One thing is scheduling is really hard. 100 clinics, different people, different schedules, different time zones. We have different time zones. So we started using a scheduling tool called Acuity. We'd like set up classes and people would sign up. So that was one thing that was like a linchpin in terms of organizing this many people. As I mentioned, we started to do these group models. I think we really dialed it in where we got our onboarding materials. So sort of locked in that we would send the deck beforehand and then we'd bring everyone together and be able to give them a certain amount of information. We also really thought about information pacing. I feel like we've talked about this a lot, Joe, of like, especially during a pandemic, during a crisis, I think any health worker is already inundated with information. Then you add on a pandemic and then you ask them to learn something completely different and new. And it's just like cognitive overload. And so we really thought hard about how we paced information, how we worded it and made it as clear as possible, and when to say what, and how to like bring people along in a not overwhelming way. So we don't tell you the whole process right away because it's kind of a lot of steps and you just need to integrate one step into your way of working. I think that was a really big piece of that. And then I think just having our support staff, like, Jason, that you can go to and you can one-to-one call them. But again, if we do a good job of giving you all the information in a really thoughtful way, the clinic workers felt really empowered to take it on their own.
Yeah, so let's hit some of the highlights. There's a lot in there, Betsy. Let's hit on the highlights. I think you're right. One of the most important things we learned early in the pandemic, I think we also used it in our Project Finish Line project with our toolkit, is that during a crisis with an overburdened health worker, especially, you have to space out the information. There's sometimes an intuition of like, just give them all the information and let them go through it. But we really, I know with these onboardings, sometimes it was a 4 or 5 step process. And we said, we do have all this information, but this is what we give them for step 1 because it's all they need to know. So it's a little bit of like, almost like being very cutthroat of like, only give them the information they need, only think about what they can take in. And I think that was definitely really important. You mentioned the tech tool that we used, Acuity scheduling. So when you're a remote team and you're trying to bring together a bunch of different people in different locations and you're trying to schedule them all for one meeting, we had to outsource that to technology. And that tool has been really, really important. So on the front end, I think all the clinics have taken part of it. They may not even know. They go, oh, I'm going to sign up for one of these onboarding. But for us, that saves us all the time of having to reach out, saying, what time are you available? When might you come in? And it allows that to be automated. And we would structure so only a certain amount of seats per. So we knew we wanted, let's say, 5 clinics in a training. There are 5 seats. So it's funny, Acuity is often used for like yoga classes and gym classes. And, we repurposed it for our own, tool onboardings. So you mentioned that, and you mentioned kind of a real kind of very specific attention to the materials that we give out. I think that is also really important, is that we are meticulous. You mentioned we have a whole team kind of working through the trainings, the schedulings, the materials to make sure they're right. The one thing you haven't hit on yet, which we affectionately sometimes call our Kalven implementation model, which you helped come up, so you know how humble you are. But we also came away to do it in waves so that we can make adjustments as we go. So we kind of have this like 1, 2, 3 model, we kind of call it, which is a way that we can make it so that any adjustments we have to make, we can make before the majority of clinics going through the onboarding. Do you want to talk about that?
Yeah, absolutely. It's so integrated. I like almost didn't even think about it. But yeah, we're always learning and always refining. And so we were like, how do we learn through this process, knowing that we won't, there'll be things we find out. So we would like take a few clinics and we pilot what we were doing with them. And we make sure there were a diverse range of people or different kinds of clinics. So we take a small handful, we do a round of onboarding, and then we like step back and be like, what worked, what didn't, And that would allow us then to integrate new findings. And then we take another kind of, if it's like a layer cake, you're sort of top and then a little bit below. We try what we'd learned and make sure it was working pretty smoothly. And then we do the bulk of all of the clinics. So again, just building in that time for us to refine, to see what we couldn't see without really doing it. So yeah, that step-by-step learning process before we sort of unleash it to everyone, to 80% of the clinic network.
Yeah, I think that's what we kind of saw. It was the first 5% would sort of be our, the ones that would test it and give us feedback. Then we would do a diversity, kind of smaller 10 to 15 clinics to say, does this work for everybody? It worked for 5. Does it work for everybody? And then once we've kind of resolved what works and what doesn't, then we want to release it to all of the other 80, folks that need to be onboarded. So I think that's a strategy we're going to continue to use. Betsy, that's when you kind of, I think, was the biggest thing, one of the biggest insights you brought to us and made that successful. So let's maybe quickly talk about the team. I know you mentioned the team, but maybe quickly again, it's you and I talking, but like you said, there are, I want to say 10 to 15 additional individuals that are part of these onboard trainings. Anything you want to say about the team? And then maybe anything you want to say about the team and any last words you want to say to the clinics themselves.
Oh, yeah.
Let's end with that.
I can't say enough good things about our Sostento team, and it's almost hard to list because I think every single person touches this, and from helpline to now. Simon helping us figure out like all the back end. He's sort of Simon is a jack of all trades and will figure out any tech problem you have. Working with Daniel and Chris on the data side and kind of what they need. We have countless people working, all of our designers, thinking about the onboarding materials, how to make them as user friendly and as clear as possible. Mira, Jason for sure. Jason was the organizing force. So he's the producer of this entire onboarding, which is a production, which hopefully seems very relaxed on the clinic side, but on the back end, it's just so many moving pieces. And then everyone who participated in the actual onboardings. Joe, you were in so many of those early onboardings. I feel like we have countless, like Rose and Megan and Christine giving us all our insights on the clinics and what they kind of need. So I could take the next hour and a half and talk about how great our team is and how many people just step in to, add their insight and make sure this runs smoothly. And then afterwards, how do we do this better next time? And on the clinic side, I just feel like they had so few weeks to learn an entirely new process, work with a new team, understand our kind of way of thinking and working. Again, in a pandemic, in a time, even just being a health worker in general is a stressful, under sort of resourced profession. And they did it with such grace and generosity. They were so cooperative. They went through so many hoops. They were generous with us as we learned how to do this better and help other clinics. And it just made our job kind of a dream. And we felt like we got to understand clinics better, and hopefully make their lives a little easier.
Absolutely. Well, thank you, Betsy, for jumping on and kind of walking through the strategy of how we got it done and how we were able to get all those clinics onboarded and going. So we appreciate it, all the hard work behind the scenes. And now the clinic has met another one of our superstars here. So thank you, Betsy, for joining us today.
Thanks for having me.
All right, we're going to keep the train moving here. And so up next, we're going to talk about how did we sustain the data collection with these clinics over an 8-month period. We had the tool, we had them trained, but then comes the marathon part, continuing to submit that data. And so who I'm going to bring on in just a moment is the executive director of the Behavioral Science Research Institute, Dr. Angela Moose, also the organization known as BSRI. Angela and BSRI are longtime partners of Sostento. They were our lead data quality partner on this project. And as well, Angela's really been with Sostento since the start. She's been leading BSRI for almost 8 years. She's got her PhD from Georgia State University, and she's my trusted advisor for everything data and evaluation. So let's bring on one of our favorite guests. Many of the clinics have met before. Let's bring on Angela. Hi, Angela.
Hi, Joe.
All right. Well, you know that you are probably our most returning special guest to, some of our private webinars with all of our clinics, and now we're bringing you to our public Sostento Live. So, for those who don't know you yet, tell us a little bit about yourself and the organization that you run.
Sure, thanks, Joe. It's great to be here. I am the Executive Director at Behavioral Science Research Institute, BSRI. We are a not-for-profit research and evaluation organization. We're based in Miami, Florida, but we do work nationally quite a bit. And our expertise is really in public health systems, specifically bringing that research and evaluation component. We often think about it as data related, right? But we've been doing work with federal funders for long before I came on as the leader. And so we have a very deep understanding of what the federal funders require when it comes to evaluation and data and how to make that the most optimal when it comes to solving these public health problems.
Great, thanks for that background. So before we go into the details of this project, one of the pieces of wisdom that I always take away from you, Angela, is you have to consider evaluation and data before the project starts. Don't come to me once the project's going and say, hey, Angela, how are we going to do this data collection? How are we going to evaluate? You say, make sure you prioritize this before the project gets going. So maybe talk a little bit about why is it so important that any organization that is going to do this kind of data and evaluation, that you do it before the project really gets going. Why is that so important?
Yeah, that's a great point. I know I say it quite a bit, but I think when it comes to our organization and our approach, it's very similar to the work that you do with Sostento. We see ourselves as sort of a bridge organization between funders and community-based organizations, or between traditional academic settings like universities and community-based organizations. And all too often, when evaluation begins after things have already started, we're only thinking about what's needed from a funder perspective. And so we're excluding community-based organizations or stakeholders from really participating in that process. We value the community's expertise. I think everyone from your team that has come on so far has touted the input that the clinics have provided, and we know that you also prioritize that. So by getting evaluation going at the beginning, we have an opportunity to really center that community experience and value that knowledge. And quite frankly, if we're going to solve any type of public health problem, we need solutions that are community driven for sustainability and scalability. They know their communities best, and they're going to know what works and what doesn't.
Absolutely. So when we got the HRSA project and we knew we were going to up our data in a collection and evaluation game, we brought you on early. So maybe you can talk about the role your team played from the very start, from those onboardings, from even coming up with the approach to maintaining excellence of data collection throughout the past 8 months. So all of our clinics have submitted data at least once every 3 weeks. We've gotten, I think, over 16,000 data points over the last 8 months. That's a whole lot of data that's come in. And your team at BSRI are the ones that really helped to make sure that we were able to keep the momentum going from the early stage. So tell us a little bit about kind of the role and how you helped us from the very start get going off on the right foot and continue that throughout the project.
Yeah, so there's a lot there in that question. I think for us, where we started was thinking through how we can be excellent stewards of these federal dollars, these taxpayer dollars, get the best data, so high quality data with validity, and also make sure that the burden on the clinics is not overwhelming or undue. The forms that came down from HRSA had excellent information, and it makes complete sense that we would want that data to drive decision-making, to drive allocations. But realistically, we wanted to recognize that for each clinic, there would be disruptions to their clinic flow and their service flow. And we wanted to make sure that we were understanding about that, and that we were really able to take on an approach that individualized that data collection for each clinic based on their needs. And I know Betsy and Daniel both alluded to this. So this was at the forefront for us. To do this, we tried to create some resources. So we created a manual, a data manual, and we included screenshots from those forms that your team worked hard on. So we wanted to say, clinic health workers, this is where you click. Then you're going to enter this here. It's a 5-digit zip code. We tried to make that, it's kind of like a a backdoor resource so that if clinics onboarded new staff or new individuals to serve as clinic health workers, they could always go there to that original manual and check in on that. And we also held check-ins with all of the clinics. So we were meeting with clinics weekly at first, and then we went to every other week and then monthly. But we were trying to be very understanding of clinics and their time constraints. We know that data is not their primary role. That's not the reason they exist, right? It's to capture data. It's to save lives. It's to help people. It's to serve their community. So we wanted to meet them where they were at. If they preferred text, we're happy to text. If they want phone call, happy to do a phone call. Email, happy to send an email. And we just wanted to keep in touch with them. We wanted to feed them back the data that they were submitting and to give accolades to them. And across the board, our team was just overjoyed with how excited clinics were to get going on this. The receptivity from them when they had questions, they were proactive about asking, and they always were just really amazing at checking in with our team.
Yeah, you had a whole team, right? It wasn't just you. You had a whole team, a whole squad that I remember came. So you had right? So this is
5 of us. There were 5 of us. Yep.
So that you were really that extension of our team. We had the Sostento team that Betsy mentioned. We had 5 folks from your team. So that, I think that shows you, if you want to get this high quality data, if you want to get it on an ongoing basis, how important it is that you have these regular check-ins. It takes a real village to make sure that just the data can continue to come in.
Absolutely. And I think that if funders want to get dollars into the hands of the communities that really have their fingers on the pulse of under-resourced communities that have been historically oppressed for decades, I think that understanding how many moving parts it really does take is important, but that also gives you the best impact. When you look at the data, the outcomes that the clinics have hit in terms of vaccinations, boosters, outreach events, when I heard countless media outlets saying, the vaccine rush is over, no one's going to go anymore. And then you see the work that these clinics have done. It's just really extraordinary.
And so my last question is then, what other factors do you think contributed to the success here? I think we've kind of hinted at some of them, but is there anything else in terms of the clinics themselves or the work that we did? What are any of the things that major factors we have already covered or anything we haven't that you think really made it successful? That we had over 200 health workers collecting data. I think we had over 12,000 individuals fill out forms too. So on top of the health workers, we had 12,000 unique individuals fill out these forms. What would you contribute the success to?
Yeah, I was astonished too. I would go into the dashboard and look and just see the numbers go up so much week to week. And, it was just fascinating to hear how the clinics were doing the work. It really comes down to the clinics being so ingrained and embedded in their community and the trust that they have with the community members that they're serving. So I think we heard, clinics trying all types of things, having outreach workers in homeless shelters, doing street outreach, really targeting niche communities and expanding those services. We also we know that some of the questions on the forms could have put community members off, right? They could be a little invasive, but clinic staff just had that rapport with individuals, and they were able to get that data, as seamlessly as possible. I think it really comes down to clinics knowing their communities, knowing their strengths, and knowing what it would take to get shots in arms, which was really what the initiative was about. So I think, kudos to your team as always for trusting that community level voice, and kudos to the clinics for doing the hard work, for vocalizing it, for saying, hey, this isn't working for me. We need another solution. And really just tailoring all of these things to meet the needs of their target populations.
Mm-hmm. Absolutely. I think trust is the word that I would use of what really underpinned all of that we did there. So, Angel, before I let you go, is there anything that you would like to say to all the clinics that are here listening in? Anything you want to share with them before we let you go?
Just a huge thanks. Your work and the dedication is the reason that we're here. It's the reason that we're celebrating. And I think it's really important for all funders to know, one, for clinics, for you to all celebrate each other, but also for funders to know that this is where the work gets done. This is where the rubber meets the road. And these clinics are doing the hard work. I believe that.
Absolutely. Well, Angela, thank you for jumping on and sharing how we maintained excellence throughout this project with our clinics. So we appreciate you. We appreciate your team. And thank you for joining us today.
Of course. Thanks so much. Great to be here.
All right. Well, we're moving through. And so what I want to quickly do before we take a short break, and we have some of our leading data collectors, our clinics leading the way on to tell you how they were successful here. What I want to do now is to show you a little bit of the results of all this hard work, which is the data dashboard that is an aggregation of all the data that you clinics who are here have collected. So let's bring that up. Let me show you a little bit about what the data looks like. So first, this is a look at the data, sort of what I call my daily bread. Every Monday when I get into the office and I have to submit my data to HRSA, I check this high level kind of look at how much data that we've collected. So this is a summary of data across the network. And it shows me how many forms have been submitted, how many health workers collecting data are active, the number of boosters, non-boosters we've done, and number of outreach events that have been submitted. As well, you can see in that little green kind of number there that's in there, what you can see is the trend for the last week. So I can both see cumulative since the beginning of March 2022. How are we looking? How much have we achieved? But I also can see that, okay, in the last week, we've done 33 first-time vaccinated as well. So we're gonna, yep, that's fine. We can keep it moving. So that's my daily bread here. So next is when we want to do a drill down. We are able to look at specific data points around number of boosters you've all been able to do, the number of first-time vaccinated you've been able to do. So we can break that down. We can see average age of those boosters. You can actually see the number of different zip codes that we've covered with boosters. So these are the zip code that the individual lives in, who has, been vaccinated and filled out the form. So yeah, you can see the kind of rich amount of data that we are able to start to drill down on once you've submitted that to us around how we are performing on a specific area like the boosters. So let's go to the next one. We can also check out geographic view to see where is the spread of these vaccines that we've been able to achieve as a network. So you'll actually see some of them that are outside of our kind of coverage zone, and that's because an individual, maybe they were a student, maybe they were in from out of town and a tourist visiting, and they ended up getting vaccinated at one of your clinics. So we can see that there are people even from outside your communities who are getting vaccinated. And you can see that, kind of where the concentration of our vaccines have been achieved. And we can actually drill down on this. We can go in, we can look at specific areas of where and when. So we can look at time series, and we can see a lot of information geographically where you all have been getting vaccinations done. Let's go to the next one. So this is now looking at the outreach data. So as you saw on that first one, anytime a clinic does a piece of outreach, you submit an outreach form. And so I think we've had over 3,000 outreach events across the network, which is incredible. Probably even more because you only submit one per day. So if you've had multiple kind of vaccine outreach events in a day, it only counts as one form. But we've had over 3,000 outreach events reported in through the network. As you can see, the reach is over 1 million people. So these were outreach that was done on social media, in person, pop-up events at the clinic. And what's cool is that we drill down to see how many people have we reached through the outreach, and how many of those indicated that they agreed to get vaccinated for one of those outreach events. And then from those people that agreed, how many did we log? So we can kind of see the trend across the network of how much outreach we need to do, how many people we need to touch to actually get to those number of vaccinations that we've achieved. So this kind of gives us an idea of the level of outreach we need to do to achieve the level of vaccination that we're looking for. So this is a little bit about the outreach data that we're able to look at on our dashboard. So let's go to the next one. So now is when things start to get really interesting, is when an individual who's getting vaccinated fills out one of our data collection forms. They include the reasons that they were hesitant or they delayed in getting vaccinated and why they decided to get vaccinated. So this is really, really important information for us to know what is being most effective, when it comes to getting people vaccinated. We don't need to just, go on anecdotal evidence. We don't have to listen to, what are folks saying? We are able to be data-driven and see that the top reasons that people are prompted to get vaccinated are because they received a flyer, information about getting vaccinated, or they've engaged with a health worker who gave them information, or they came in a community event. So we can start to see what are the reasons people are maybe hesitant to be vaccinated, and what are the reasons that they did get vaccinated. And with this data, we're also able to do the time series. So we can look over the last month, how is that trending? Are there new reasons for hesitancy? Are there new reasons that are people getting vaccinated? And that allows us to adjust our strategy with all of you. Because you get this data filled in, we are able to really understand why are people getting vaccinated, what are their hesitancy, and we can adjust our strategy to help you. So this is a really important piece of aggregate data that we are often looking at. Next slide. So on top of that hesitancy or why they got vaccinated, we can, again, kind of break that down by state as well. We know that there are different, pieces of information that may be received differently based on the communities you're in. So we do also drill downs by state and sometimes even down by clinic or community because we know that there can be difference in state by state, community by community context. So not only does our data collection dashboard allow us to see aggregate reasons, but we're also able to drill down by state and even by clinic, and sometimes even by health worker if we want to. We can really drill down into this information, and that is a really, really powerful tool that you can see that, by empowering all of you to collect this data. You saw kind of at aggregate the impact, the story that we can tell, but now we can actually start getting insights. We can start seeing what is working and why through analyzing the data at a high level, but also drilling down into a state-by-state or community even level. Next slide. This one is also really cool, we also look at the same data of why individuals are not getting vaccinated. And we say, well, what are the biggest barriers? And we saw one of the largest kind of reasons for delay or vaccination hesitancy was that people didn't have transportation to get access to the vaccine. We know a lot of patients of free and charitable clinics who all live below the poverty line often are working poor. They work 9 to 5. They may not have a car. They may have to rely on public transit or a friend or a family member to get to the clinic. And we were able to see in our data that, yes, that was a huge barrier to people getting vaccinated. And that led us to prioritize our relationship with Uber Health and to really look for a solution around that transportation barrier. So again, because you all are collecting this data, we can see what are the biggest barriers being faced. Can we eliminate those barriers? And then can we see those numbers coming down? And are there other barriers that we should be tackling? So again, that's really, really amazing validation to see that, when you submit the data, we can adjust our interventions to your needs. All right, next slide. And I think this is our last one here, just briefly to show you an aggregate, the top outreach methods and where this outreach is happening. So we're also able to track, kind of where this education is happening across the network. What are the kind of most, high volume ways you all are doing outreach? So again, we can allocate our time, our staff time, our energy, our resources into the ways that are most useful to you. So we're really able to see, how you're doing your outreach, where you're doing your outreach, and the kind of specific population demographics that you're reaching with the outreach. That can inform the most effective ways that we and you all use your time and energy and resources. That's just a little bit of a quick look at that data dashboard, some of the results of collecting all that data. And that's just the tip of the iceberg. We are going to be continuing to work throughout this project to look at ways that we can make more of this data useful, actionable, not only to us, but to all of you. And let me see, there's a comment that just came in that, yeah, I think this is thank you, Kayla. Absolutely. This is kind of something I would totally agree with, and you can see the results of taking on this big challenge with our team. You've heard from the team. You've now seen some of the results on our data dashboard. So now what we're going to do now is we're going to take a quick 3-minute intermission. And we're going to come back and we're going to hear from two of the frontline clinics about how they successfully use the data collection tool. So if you have to run to the bathroom, grab a coffee, have a drink, do it now. And also for maybe anyone who is going to sit in the chat and they're waiting, what are you going to be for Halloween? So we want to hear, are there any Halloween costume ideas? With our, webinars and our Sostento Live, we have to like to have a little bit of fun too. So if you're a clinic worker, if you're someone listening in and you know what you're going to be for Halloween, put that in the chat. And we'll see what we have during the intermission. We can see what kind of our network is going to be looking to maybe come as Halloween. We'll hear the results of that. We'll be back in about 3 minutes, and we'll bring on our two frontline clinics to talk more about how they achieved data collection in their communities. Everyone, and we are back. I didn't see anyone put in their Halloween costume, so maybe we're all adults here, and so no dress up. But maybe we should next time we'll ask favorite Halloween candy. So we'll adjust that question because even though we're all adults, I'm sure we can all still enjoy some candy here. But I don't want to waste any time bringing on our two clinical leaders who are going to come in and talk about how they achieve data collection in their communities. We know across our network, we have small clinics, we have large clinics, and so the volume of data collection can vary, but every single data point is super important. But what we're going to bring on are two of our clinics that are our highest yield data submitters, so we can just learn about what does this look like at scale, on the ground, collecting data with your health workers and with your population. Without further ado, I would like to bring on two free and charitable clinical leaders from our program. So let's bring them on. All right, welcome. I'm so excited to have two of our frontline healthcare leaders, one from Texas, the other from Pennsylvania. So let's get started first with Liaquat Khowaja, who's the executive officer from the Sina Foundation in Houston, Texas. Liaquat, say hello. Tell us a little bit about yourself and your clinic.
Okay, I know we are behind, so I will quickly introduce myself. My name is Liaquat Khowaja, and I work with Sina Foundation. This is my 9th year, and every year I think that I am tired. I may think of some easier job for me, but then I don't have courage to leave this foundation because whatever we have been serving from this foundation is phenomenal. Just quickly, that we were a very small organization. Now we have 7 standalone community clinics, and we provide not only medical services, but we started with medical. Now we have mental health, dental services, behavioral health, and many other programs. And during the COVID, we have impacted the community in a great and positive way, and we are very grateful for the opportunity that COVID has brought to this foundation, and we were able to serve hundreds of thousands of community members, mostly who were uninsured, underinsured, living in medically underserved areas. And we have not only provided the services from our clinics, but from the outreach events and communities, giving them the services, educating them, and this is what I feel that Sina has put an amazing impact on the community with this, with the all COVID-19 related efforts, whether it was testing or it was vaccination or any other related things.
Yes, thank you, Liaquat. Your clinic was one of the first ones we worked with as well. You picked up Helpline SOS, and I never will forget the first day we turned on your Helpline SOS, the calls just started coming in. You know
that.
Yeah, so we know that not only have you been serving your patients, but the community at large, a growing foundation, free and charitable clinic, always inspiring, Liaquat, to hear more about your clinic. So up next, we're going to go over to our #1 vaccinating clinic in College Park, Pennsylvania. And we have Cheryl Trombley, who is the clinic vaccine coordinator at Center Volunteers in Medicine. So Cheryl, please come on, introduce yourself and tell us a little bit about your clinic.
Sure. Thank you so much for having me. My name is Cheryl Trombley. I am a staff nurse at Center Volunteers in Medicine in State College, Pennsylvania. This is where the main campus of Penn State University is located. So we have college town and gown aspect of life, and we also have a large rural community surrounding us. We provide medical and dental care to the uninsured in Center County. We also provide, in addition, we provide behavioral health, medication assistance, and case management. In January of 2021, we started doing COVID vaccines here on site in our clinic, very small clinics. I think we started with 50. And by February of 2021, we were doing Super Saturdays and doing 2 trays of Pfizer every Saturday, rotating first and second doses. So at the end of 2020, we gave just over 40,000 COVID vaccines. And for 2022, this year to date, with yesterday being our last clinic, we've actually given a total of 47,000 between 2021 and 2022. And it's been a very rewarding experience. We also do testing here in our clinic. And having said that, what I thought I was going to say after that, I've completely switched tracks. And I just wanted to say that I've never done grant work before. When my executive director and clinical services director approached me about data collection for the grant work, I said, okay, we'll try it. And having heard Daniel, Betsy, and Angela and everything that they did to build the tool and implement the tool and train us, I have to say it was pretty seamless, I feel. At least on our end. I hope on your end as well. I just have a deep appreciation for everything that Sostento has done.
Well, thank you, Cheryl. I still remember back in 2021 when there kind of was the vaccine craze days, talking to your executive director and hearing how you were renting out middle school gymnasiums that were being donated to you, how many people you're doing, that your free and charitable clinic was really one of the only vaccinators in the area that people could come and get access to that vaccine. And I think the free and charitable clinics are the kind of best kept secret in the public health space. And I think your clinic really demonstrates that. So Cheryl, thank you for those kind words and for all the hard work that you've done. And yes, it has been seamless for us as well working with your clinic. So that has been great. So now let's talk a little bit about how your clinics were able to get this all done. Liaquat, talk to me about how your clinic was able to incorporate this new data collection tool into your daily operations. What made it successful for you? How did you do it?
So you know that our clinics are very busy, right? The day you started working with us, you started receiving many calls. So every day we have many new patients. Every day we have many new programs. I mean, every month we have different new programs in our clinic. So our staff, which is more than 100 staff members, and we are crazy, extremely busy at our parts. But see, this was an opportunity, and I'm thankful to your entire team that they have been helpful. I know that our staff members who are working specifically for this Sostento project, they had initially different challenges in collecting and reporting those data points. And finally, we were able to make sure that we have dedicated staff members who specifically put some time from the day and make sure that everyone is collecting the data. If they have challenges, we ask your team members, they were fixing it. And then, so this was the turnaround. So we were trying to close any loop within the same day. That way we have the right data in. And our team, again, it is not me that I have done a lot. It is our team who has done, and your team who has helped all every moment to solve the problems, and we were able to collect the data, whether it was in the community outreach, whether it was in the religious center, or it was in any other event, which is a health fair type of event, and they were there and they were having those iPads in the hand, meeting with people. So we made sure that whatever data points have those specific question marks, those are asked, answered, and rightly inputted into the word. It was difficult, but we are successful, I hope.
Yeah, no, I think you're right, Liaquat, that early there are going to be challenges, right? So you kind of understood that in the beginning it's going to be a learning curve, but it sounds like it was communication with your staff, helping them resolve the challenges in real time, making sure it didn't linger. And it felt like I do, when I see that data come in from your clinic, you obviously, at the end of the day, did we get our data in? Has it gone in? And so it's really when it becomes a habit, a daily ritual like that, it definitely makes a huge difference.
Yes.
All right. So Cheryl, over to you. I know that as well. You have many volunteers. You have a really interesting setup at your clinic. Can you tell us about how, in your setting, in more rural, Liaquat's in a more urban Houston area, you're in a more rural area. Maybe just talk a little bit about how you were able to integrate the data collection into your program in over there in Pennsylvania.
Well, the bigger vaccine clinics certainly helped, and you mentioned our volunteers. We just couldn't have accomplished what we did without those volunteers, and they are very dedicated. And when I approached them during our clinics and with the questionnaire, and explained what we were doing and why we were collecting the data, they were all in. And so while the folks were waiting their 15 minutes after their vaccine, the volunteers would circulate through the waiting area with the QR code, or we did a lot of paper copies, but that's just the nature of it. And here at the medical clinic, every physician talked to their patients during their visits. We kept count of how many patients we were seeing each day, who got a vaccine, who filled out a questionnaire. Our volunteers up at our reception area, also very dedicated. They fielded, every time a new vaccine was approved, they would field, many, many phone calls with questions about the vaccine and about the clinics. And we did we would take them out to our home visits, wherever we went with vaccine, the survey went with us.
So Cheryl, let me ask you a follow-up, but then we'll come back to Liaquat here. So you kind of spoke to like the key moments you can get an individual to fill out the form, because for me, that was the biggest challenge that we thought going into it. It's like having a health worker fill out a form. Okay, we can ask them, they're a staff or a volunteer of the clinic, but then asking a patient who, I've gone to a number of vaccine events. People are not like, necessarily wanting to talk to you or wanting to give you information. How did you overcome that challenge of getting patients to fill out and submit data for you?
So I think a lot of it is based on the fact that we had been doing vaccines before we started the data collection. And what Angela said earlier before the break about the building trust with the community, center volunteers definitely became kind of a household word for anybody who was interested in getting a vaccine. And to be perfectly honest, we hardly had anyone decline to fill out the survey. And I explained it to people like, we're just trying to keep the vaccine machine going. This is helping us, and this is helping us do what we're doing. And they were, the community was very, very cooperative.
You speak to something that I do have seen in practice, which is that your clinic and the free and charitable clinics have a trust of the patient base in the community. If someone was going to a max vaccination site, they didn't know who the people were there, I think there would be a lot more hesitancy to submit information. But I know that a lot of the free and charitable clinic staff and volunteers, they know the patients by name. And in your case, I think you built a reputation of, okay, this is the community-based group that is powering the vaccine machine and getting everyone this life-saving service. And I think that reputation, that trust is so important when you want to then go into the data collection.
Yeah, and we did also have a fair number of people who said no at first. We always told them it was optional. And then they'd see everybody else filling it out, right? And think, oh, well, I guess I could do that. So.
Absolutely. Yeah. And Liaquat, what was your experience like? How did you get the patients? I mean, you have a high volume of 7 different locations,
yes.
For a huge diversity in patients. How did you approach this challenge of getting actual members of the community and your patients to fill out and submit data?
Yeah. So see, this was a challenge at our clinics too, but we have a great network, our great resources through which we have connected to maximum community organization, other community organization who have a great association with the Sina Foundation. So what we did, we have started talking to all the leaders. We used to have different meetings. We used to go, and our board was also engaged, involved. So through them, we were just spreading the word. And Ibn Sina, if you come to Houston, whether you go to City of Houston's health department or you go to any other public health department, you will find Ibn Sina's name is there. Even we have vaccinated many of the health department people at our clinics. So that name was spread through the community leaders. Now those leaders, once they are referring patients to our clinics or to outreach events, they had very, less reluctancy to say no. So we had no initially a lot, but then they had some comfort. Okay, their leader has referred to us. Now we have our team. They were, from different backgrounds, ethnicities. We have people from Pakistan. We have people from India. We have people from Africa. We have staff from Hispanic, origin. So we had all those people working in the field, working with different clients, and we were successful.
So it sounds like both of you have talked about a little bit of patience and let peer pressure take hold, that if they see themselves in the staff and volunteers, if they see other, maybe patients that are, or individuals that already are very familiar and trusting of your groups, that allows there to be sort of this, hey, this isn't like a big deal. This isn't scary. There is some kind of like common community effort. And we're all in this together, like public health, that's kind of the idea, is we're all in it together. And so I think that it's a factor, but you've both spoken to the power of free and charitable clinics that you all have in your community, the reputation, that people know your name. and know that they can come to you not just for vaccination, but for primary care, for mental health services you both mentioned. So I think that kind of knowing that your groups are also embedded in the communities and are not coming in to do something and then leaving, sounds like that was a big
And
factor.
I just want to add one thing, that we have been working on the integrated behavioral health for past many years. We were not successful, but this COVID has given us some opportunity. That way we have been, because that was one of the challenge which community members have faced. They had different anxiety, stresses, whether we get vaccine or not. So we had free counseling sessions. We had a psychological, support, peer groups. We have done different activities with the members, with the leaders, and I think that was one of the reasons that we were successful in vaccinating over. I think we have provided over 80,000 doses. Yes.
Yeah, amazing. All right, so we're coming up on time here. And so folks need to go. The recording will be available. You can come check out. We're going to give some cool information after the interviews, but we might go a little over time, but we understand some folks need to go. But I want to make sure we get the most insights from both of you since we have you here. Is there anything that, when this, let's say, data collection ends, are there things that you've learned that you're going to bring forward into the future around data collection? Are there types of data you wish you could hopefully collect in the future? Are there any long-term practices that you've done here that you're going to continue on? So Cheryl, I'll start with you. So again, the question is a little bit about the things that you've learned through this. Is it, how are you going to continue it on at your clinic? What are some ways that you think you might continue on, things that you would like to be doing in the future?
Well, I have to think about that one for a minute. But another part of your question, as far as outreach, that was not something that I did a lot of here at CVIM before we started this. But, I thought about it. We sent out flyers with the Meals on Wheels meals. For home visits, specifically for people who couldn't get out of their homes. And we went to the YMCA Kids Fair to educate, our community about kid vaccines. So I'm hoping that we can continue on with that type of outreach. I don't think the COVID vaccine is going to go away, soon. So I think we're going to have to find new ways to reach out. So it's not just something that people are hearing and, have been hearing about for 2 years. Got to get people excited.
I love that, Cheryl. So you're really thinking about sustainably, what are the elements that, we want to be able to do into the future? And to me, that is important for sustainability, but also for preparedness. So that if there ever were a case where you needed to activate quickly, you're in the habit of it, you've continued to do it. I think that's a really powerful message to the other free and charitable clinics here of why you might want to continue doing this. It's a capability you want to keep sharp for your clinic. Because like you said, we may be doing annual COVID vaccines. We don't know yet. And so I think that's a really, really good point. How about you, Liaquat? Any thoughts about things into the future you're going to carry forward with your data collection, lessons learned, things you hope to do in the future?
Yes, so we have learned many lessons. We will definitely continue doing some of the data collection, methods, but we have other programs associated, not only COVID vaccine related, but are education related, but some other programs, as we have mentioned, that we are more promoting now behavioral health. So wherever possible, we will try to see whatever data points we can gather, which can help us in the future planning and any whether it is the annual COVID vaccine plan. I will be very happy if from our data we can have those points that, okay, these are medically underserved population or underserved areas, which from the HRSA website we can, I think you may have that access, how you can roll that out and show to our clinics and everyone that, okay, this is where we have put focus, or these areas are 100% vaccinated or 80% vaccinated. Some areas are not vaccinated well, so we can put focus on that. So I think that will be valuable to us. Specifically, our goal is to serve those communities which are underserved, uninsured, indigent community. That way we can reach and collect, and it is not very difficult to work with them. They have many questions. I know they have many questions, which if we are ready, we will be happy to answer them, and we will see if we can provide them the services on a regular basis in a sustainable environment. Yeah.
Great. Well, thank you, Cheryl, Liaquat, for leading the way with the free and charitable clinics, for showing us, the power of what we can do when we come together. And I like, Cheryl, you said seamless, when we just unite and we say, okay, if we're clear, if we're consistent, the kind of, work we can do. So both of you have been such an inspiration to our team. And I hope, some of the HRSA folks who may be joining us got to see, who are the folks that are, behind some of that data. It's easy to see data as just a number, but it's really representative of real people, real interventions, real impact. So I want to thank both of you for your time. We hope to continue working with you in this and other areas into the future. So thank you both for spending some time.
Thank you.
Thank you so much.
All right. Well, we're a little over time, but I see a few of you are sticking around. So we're going to go for another 5 minutes or so. Next, what we want to do is a little celebration. All of the clinics across our network have been working so hard to collect this data. And I believe we have some photos that we wanted to share and scroll through, celebrating some of our clinics who've been collecting that data. So here's just some photos. I got to meet some of them. So this is me with some of those leaders. We know the amount of hard work on the ground that it takes to collect this data, the amount of coordination. It's no small feat. And so while, the Sostento team hasn't been able to meet each and every one of you, we want to know that when we see your data come in, we are looking at it. We are thinking all the time, how can we better serve all of you? What are your needs? Who is doing what really, really well? What lessons can we pull out from the network? What ways can we share those insights with a wider network? How can we get you media attention? And so really, we think that at this point in the project, there is a lot of reason to be celebrating with all of you. I'm so, inspired and, really, really, really thankful to have the opportunity to work with you. For those who maybe are newer, is we made a pledge in early 2021 that we would raise funds, that we would support clinics in this way. And I'm so happy that we were able to deliver. We were able to strengthen the network and achieve what we've been able to achieve. And our hope is to continue with these lessons learned into the future. So I hope you've enjoyed a little bit of a slideshow of some of the faces and people that we've got to meet along the way. So let's close out here with a few closing remarks. This has been a really wonderful session. Thanks everyone who is still here. I see still 40 plus people listening in to the exciting news of what we have next Sostento Live. So next Sostento Live will be our last one of the year. It will be focused on how can we raise awareness and reduce health worker burnout. We know health workers have been burning the candle at both ends throughout the pandemic. We know how exhausted and tired everyone is. And what we want to do is raise awareness about health worker burnout, ways that we can combat it. So on November the 15th at 4 p.m. special time, so November 15th at 4 p.m. Eastern, we will have a Sostento Live dedicated to raising awareness and reducing burnout among health workers. So if you've stayed to the end of the live session, we have an event. It's going to be called the Turnout for Burnout. We're going to be looking to mobilize resources for all of you. So you'll be learning more about that, about how you can participate. I would say that this live event is for your staff, your community to join, because we're going to be looking to activate the community and some very specific special individuals to see what they can do to support our efforts in 2023. We want to focus on addressing burnout among health workers. And we want to do that in a meaningful way. I've already talked to health workers. We don't want to give you just another day off or, a free lunch or a spa day. You deserve that. But what we know is the best way to reduce burnout among health workers is to continue funding your staff, to work on upstream problems that reduce the burdens of your patient and community populations. That's the best way we can reduce your burnout. So what we're going to be doing on November the 15th is kicking off a campaign, Sostento's end of the year campaign, where we're going to be trying to raise awareness and resources so that 2023 we can have a special effort and program to reduce and prevent burnout among health workers. So I hope all of you can join us. We'll be emailing everybody more about that event as well with a recording of today's event. So keep an eye out for the invitation. Again, this is the event to invite your whole staff, your community to. This is not just for our network, especially this Turnout for Burnout. And that will be 4 p.m. Eastern special time, November the 15th, the last Sostento Live of the year. So I want to thank everyone for tuning in today, and I hope to see you at the next one. Thanks, everybody. Take care. Bye.